Day 7 of the collapse. Your daughter's fever is 104. The cut on her hand from breaking that window. It was nothing. A clean slice, 2 inches long. You stitched it yourself, dressed it properly. But now the edges are red and hot. The infection is spreading. She's shaking, delirious. You know what happens next. Septicemia. Organ failure. Death. You grab the antibiotic stash from the safe. Amoxicillin. The pills are supposed to be white. They're beige now, crumbling between your fingers. Expired 10 months ago. You try the tetracycline. Same story. The azithromycin. Useless powder. Every bottle in your stockpile turned to garbage. Pharmacy 40 miles away, probably looted. Hospital unreachable. And your child is dying from an infection that would have been trivial a week ago. The survival industry sold you medical security theater. But there are 3 antibiotic strategies they never mentioned, not because they don't work, because they work too well. Let's start with what kills more people in collapse than bullets. Infection. Not gunfire, not starvation, not dehydration. Bacterial infection from injuries you'd walk off in peacetime. Before 1928, before Alexander Fleming discovered penicillin growing on a contaminated petri dish, a simple cut could kill you. During World War I, more soldiers died from infected wounds than from the wounds themselves. Pneumonia, gangrene, septicemia. The mortality rate for compound fractures was over 80%. An infected appendix meant death. A tooth abscess could spread to your brain. You got a dirty injury, you died. That was reality until 1940. Fast forward to today. Every prepper I've met has the same setup. Fish antibiotics in the safe. Amoxicillin, doxycycline, azithromycin. Maybe some Cipro if they're serious. Bottles and bottles stockpiled from online suppliers. Veterinary packaging, same active ingredients as human prescriptions, fraction of the price. You think you're prepared. You're building medical resilience. Broad spectrum coverage for pneumonia, UTIs, skin infections, dental abscesses. You're not. You're building a graveyard of chemical time bombs, and the clock is already ticking. Because here's what nobody tells you when you're panic buying fish ox on Amazon at 2 a.m. Every single antibiotic you've stockpiled has a built-in death sentence. And it's not accidental. It's profitable. There are 3 approaches that don't fail. But first, you need to understand why everything in your stockpile is already dead. Here's what they don't advertise in big letters on the bottle. Every modern antibiotic you've been told to stockpile is chemically unstable. And that instability isn't a quirk of nature. It's engineered obsolescence wrapped in pharmaceutical packaging. Let's start with the most common antibiotic in prepper stockpiles, amoxicillin. It's a penicillin derivative that kills bacteria by destroying their cell walls. The active part of the molecule is called a beta-lactam ring. 4 atoms arranged in a square. That ring is what makes it work. It's also what makes it die. The beta-lactam ring is fragile. Moisture breaks it open. Heat breaks it open. Time breaks it open. When water molecules hit that ring structure, it hydrolyzes, falls apart. When the ring breaks, the antibiotic stops working. You're left with inactive degradation products that in some cases are toxic. The manufacturer knows this. That's why the bottle says store in a cool, dry place. But here's the problem. Cool and dry means 68 to 77 degrees Fahrenheit and less than 60% humidity. Your garage in summer hits 95 degrees. Your basement floods. Your bug-out bag sits in your truck. You're not storing these in a pharmacy. You're storing them in the real world. And in the real world, amoxicillin starts degrading the day you buy it. Official shelf life is 2 to 3 years under perfect conditions. In your garage, you're looking at 12 to 18 months before potency drops below therapeutics levels. After that, chalk. Now let's talk tetracyclines. Doxycycline, tetracycline. Broad-spectrum antibiotics that work by jamming bacterial protein synthesis. Bacteria can't make proteins. Bacteria die. But tetracyclines have a different failure mode. They're photosensitive. Light degrades them. UV light breaks down the chemical structure into anhydride tetracyclines and epianhydride tetracyclines. These degradation products don't just stop working. They're nephrotoxic. They damage your kidneys. You store doxycycline in a clear bottle on a shelf. Sunlight hits it through the window. UV radiation breaks it down. Even artificial light degrades it over time. Shelf life under ideal conditions is 3 to 5 years. In a prepper stockpile with ambient light and variable temperatures, you're looking at 2 years maximum before it becomes actively dangerous. And here's the kicker. The pharmaceutical industry knows all of this. They've known it for decades. They could reformulate these drugs for stability. They could engineer molecules that don't fall apart in heat and light. But they don't. Because a drug that expires means you buy it again. And again. And again. A customer who solves their problem once is a customer they lose forever. So they sell you chemical time bombs wrapped in veterinary packaging and let you think you're prepared. But what if I told you there's an antibiotic class that was deliberately phased out, not because it stopped working, but because it worked too well for too long? In 1943, a single class of drugs saved more Allied soldiers from infection than any other medicine in the war. Not penicillin, sulfonamides, sulfa drugs. Every medic carried them. Every field hospital stocked them. Sulfanilamide, sulfadiazine, sulfathiazole. They stopped wound infections, pneumonia, meningitis, dysentery. Millions of lives saved. And here's what makes them different from every antibiotic you've stockpiled. They don't expire. Sulfonamides are sulfur-based antimicrobials. The chemical structure is a benzene ring with a sulfonamide group attached. Simple. Stable. The molecule doesn't have fragile components like beta-lactam rings. It doesn't photolyze under UV light. It's a crystalline solid at room temperature. That means the molecular structure is locked into a rigid lattice. It doesn't react with moisture. It doesn't degrade in heat. The shelf life of sulfonamide drugs is 10 to 20 years, not under perfect laboratory conditions, under normal storage, room temperature, normal humidity, no refrigeration required. You can leave a bottle of sulfadiazine in your garage for a decade, and it still works at full potency. Compare that to amoxicillin dying in 18 months. The mechanism is chemically immortal. Sulfonamides work by mimicking para-aminobenzoic acid, or PABA. Bacteria need PABA to synthesize folic acid, which they need to make DNA. Sulfonamides look enough like PABA that bacteria absorb them instead. But sulfonamides can't be converted into folic acid. The bacteria's metabolic pathway jams. They can't replicate. They die. This isn't a complex mechanism that requires a delicate molecular structure. It's molecular mimicry. And because the sulfonamide molecule is chemically stable, it keeps working year after year. Decade after decade. The effectiveness is broad spectrum. Sulfonamides kill Streptococcus, Staphylococcus, E. coli, Nocardia. They treat skin infections, respiratory infections, urinary tract infections, gastrointestinal infections. The same infections you're stockpiling amoxicillin and doxycycline for, and they're still manufactured. Silver sulfadiazine is the gold standard for burn treatment. Every burn ward in America uses it. Why? Because it works and it doesn't expire. Veterinary suppliers still sell sulfonamides for livestock. Same chemical, same effectiveness, sitting on shelves for years without degrading. This is technology that outlives you. You could buy a bottle today, seal it, pass it to your children, and it would still work when they need it. You're not rotating stock every 2 years. You're not replacing your entire medical cash every time the calendar flips. You buy it once. So if this drug class is so effective, so stable, so combat-proven, why did it disappear from human medicine in the 1950s? Why isn't sulfatazine in your doctor's prescription pad? Why isn't it in your medicine cabinet instead of crumbling amoxicillin? 2 reasons, and neither of them is performance. Here's the real reason. Reason 1 is what they'll tell you if you ask. Penicillin came along in the 1940s, and it was better. Faster acting, fewer side effects, more targeted. Sulfa drugs could cause kidney stones and allergic reactions in some patients. Penicillin was cleaner. So the medical establishment moved on. Progress. That's the cover story. Here's the truth. Penicillin was patentable. Sulfonamides went off patent in the early 1940s. Anyone could manufacture them. No licensing fees, no exclusivity. Generic manufacturers could sell sulfadiazine for pennies on the dollar. There was no profit margin left for pharmaceutical companies. Penicillin, on the other hand, was new. It was patented. And that patent meant 20 years of exclusive manufacturing rights. Premium pricing. Massive profit margins. Every prescription generated revenue for the patent holder. The pharmaceutical industry didn't switch to penicillin because it was better for patients. They switched because it was better for business. But here's the real reason sulfa drugs disappeared. Reason 2, the one nobody talks about. A 20-year shelf life is a customer you only see once. Modern antibiotics expire in 2 to 5 years. That means you're back at the pharmacy every few years for a new prescription, or you're rotating your stockpile, buying new bottles, discarding the old. You're a repeat customer. You're generating recurring revenue. But if you buy sulfadiazine once and it lasts 2 decades, you're done. You're out of the market. You solved your problem permanently. And in an industry built on chronic treatment and planned obsolescence, a permanent solution is a catastrophe. The pharmaceutical business model requires that you keep buying. A drug that works indefinitely breaks that model so completely that it has to be phased out, not because it fails, but because it succeeds too well. And here's the kicker. You can still get these. Veterinary suppliers sell sulfonamides for livestock. Same chemical formula. Same stability. Same effectiveness. Lower regulatory scrutiny because it's classified as animal medicine. Silver sulfadiazine is still over-the-counter for burns. The drugs didn't disappear. They were just removed from the profitable human prescription market. You've got antibiotics that last decades. But what if the supply chain completely collapses? What if there's no pharmacy, no veterinary distributor, no Amazon delivery? You need a second option that doesn't require any supply chain at all. If antibiotics become completely unavailable, if every supply chain breaks, if you can't source veterinary sulfa drugs, you need something that doesn't depend on manufacturing infrastructure. You need something you can produce yourself. There's a material that's been killing bacteria since before antibiotics existed. Used medically from the 1800s through the 1930s. Every hospital had it. Every doctor prescribed it. Then penicillin showed up and it disappeared from the textbooks. Not because it stopped working, because it couldn't be patented. Colloidal silver. Before you dismiss this, understand the mechanism. This isn't alternative medicine mysticism. This is chemistry. Ionic silver disrupts bacterial cell membranes. Silver ions bind to thiol groups in bacterial proteins. That binding interferes with cellular respiration and DNA replication. The bacteria can't maintain membrane integrity. They can't reproduce. They die. The effect is broad spectrum. Silver kills Streptococcus, Staphylococcus, E. coli, Pseudomonas, Salmonella. It's effective against some fungi and viruses. Not all, but enough to matter when you're treating a wound infection or dysentery, and the pharmacy is rubble. And here's what makes it different from every pharmaceutical antibiotic. The shelf life is indefinite. Silver doesn't degrade. It's a noble metal, chemically inert. You can store colloidal silver for years, decades, and it maintains full antimicrobial activity. Compare that to amoxicillin dying in 18 months or doxycycline breaking down under UV light. But it gets better. You can make it yourself. Take 2 pieces of pure silver wire, suspend them in distilled water. Run low-voltage DC current between them, 9 to 12 volts. The current strips silver atoms off the anode. Those atoms lose electrons and become silver ions. The ions disperse through the water. After 20 to 30 minutes, you've got colloidal silver, parts per million concentration. Ready to use. The equipment costs less than $50. Silver wire, a power supply, distilled water, a glass container. That's it. You're not synthesizing complex molecules. You're using electrolysis to suspend metallic ions in solution. It's basic electrochemistry you could teach a high school student. NASA uses silver for water purification on the International Space Station. It's not experimental. It's not fringe science. It's proven, deployed technology keeping astronauts alive. But try to find it approved for internal antimicrobial use in American civilian medicine. The mechanism is proven. The safety record spans over a century of documented medical use. The production method is simple enough to do in a garage. So why isn't every survival manual teaching this? Why isn't your doctor prescribing it? Why isn't it FDA approved for internal use? Here's why your doctor can't help you. The FDA approval process is designed for synthetic, patentable molecules, not natural compounds, not elemental metals. To get FDA approval, you need clinical trials. Phase 1, Phase 2, Phase 3. That's 10 to 15 years of testing. It costs $100 million to $500 million. And here's the problem. No pharmaceutical company will fund those trials unless they can patent the drug. Patents give you 20 years of exclusive manufacturing rights. That's how you recoup the investment. Premium prices while competitors are locked out. But you can't patent colloidal silver. It's elemental silver suspended in water. You can't patent an element. The periodic table isn't intellectual property. Anyone with silver wire and a battery can make it. No exclusivity. No profit protection. No return on investment for clinical trials. So the trials never happen. Without trials, no FDA approval. Without FDA approval, doctors can't prescribe it. Medical licensing boards make sure of that. A doctor who recommends non-approved treatments risks losing their license. The liability is too high. Malpractice suits. State medical board investigations. Even if the treatment works, the doctor's career is over. Insurance reimbursement only covers FDA-approved drugs. If your doctor prescribes something alternative, you're paying out of pocket. Most people can't afford that, so they stick with approved antibiotics that expire in 2 years and cost $200 per prescription. This is the system working exactly as designed. The FDA pharmaceutical revolving door. Former FDA officials get hired by pharmaceutical companies. Pharmaceutical executives get appointed to FDA advisory boards. The people regulating the industry are the same people who profit from it. The regulatory framework isn't broken. It's functioning perfectly. Just not for you. It's protecting profit margins, not patients. A treatment that can't be patented can't be monetized, and if it can't be monetized, it gets buried under regulatory barriers. Compare this to other countries. In parts of Eastern Europe, colloidal silver is still used medically. In India, Ayurvedic medicine incorporates silver compounds, broader medical freedom, less regulatory capture, systems that allow treatments that work even if they can't be patented. But in America, the system is locked. The FDA controls what doctors can prescribe. Insurance controls what patients can afford. Both systems funnel money toward patentable pharmaceuticals that generate recurring revenue. You've got stable antibiotics if you can source them. You've got alternatives the system won't acknowledge. But there's a third option, and it's the one that makes you completely independent. No supply chain, no regulatory approval. Just knowledge they can't regulate away. This is the most dangerous item on this list. Not because it's harmful, because it makes you ungovernable. Plants have been fighting bacteria for 400 million years. They've evolved chemical weapons we're only beginning to understand. And the knowledge of how to use them can't be regulated because you can't ban a garden. Garlic, not the clove you toss in pasta. Concentrated extract. The active compound is allicin. When you crush fresh garlic, alliinase converts alliin into allicin. Allicin is a sulfur compound that disrupts bacterial metabolism and enzyme function. Bacteria die, but you're not eating raw cloves. You're making a tincture. Crush fresh garlic, let it sit 10 minutes. Macerate in high-proof alcohol, 80 proof minimum. Extract for 2 weeks in darkness. Strain. You've got concentrated allicin stable for months. Therapeutic dose is 2 to 4 milliliters 3 times daily. That's 30 to 60 times more potent than raw garlic. A 2014 study in the Journal of Antimicrobial Chemotherapy showed garlic extract inhibits MRSA, methicillin-resistant Staphylococcus aureus, the superbug killing 20,000 Americans per year. Garlic extract disrupts it. Oregano oil, not dried herb. Steam distilled essential oil from Oreganum vulgar. Active compound is carvacrol. It destroys bacterial cell membranes like detergent dissolving the lipid layer. Membrane breaks, bacteria leak, they die. Therapeutic dose is 150 to 600 milligrams per day, diluted in carrier oil. Pure oregano oil is caustic. Studies in Frontiers in Microbiology show carvacrol kills E. coli, Salmonella, Pseudomonas aeruginosa, raw honey, Manuka honey specifically. It produces hydrogen peroxide enzymatically. Hydrogen peroxide kills bacteria on contact. High sugar concentration creates osmotic pressure that draws water out of bacterial cells. They dehydrate and die. Medical-grade honey is used in hospital wound care. Proven treatment for infected burns and surgical wounds. Internal dosing is 1 to 2 tablespoons 3 times daily. Here's why this is dangerous. These are food plants. You can grow garlic and oregano in your backyard. Buy honey at any grocery store. The FDA classifies them as food, not drugs. They can't restrict access, can't require prescriptions, can't control distribution. And the knowledge of preparation, concentration, therapeutic dosing, spreads peer-to-peer. You teach your neighbor, they teach theirs. Medical knowledge networks outside institutional control. They can't ban gardens. They can't ban knowledge. That makes you medically independent. 3 approaches. Stable old drugs, suppressed alternatives, knowledge they can't regulate. Now let me show you why this pattern exists everywhere in medicine and what it means for your survival. Let's step back. 3 approaches. Sulfonamide drugs with 20-year shelf life. Colloidal silver you can produce yourself. Antimicrobial herbs you can grow. Before today, you'd never heard these framed as serious preparedness. That's not an accident. That's a pattern. The medical industry isn't built on solving problems. It's built on managing them, selling temporary relief that requires renewal. Every prescription engineered to expire because a patient who solves their problem permanently is a patient you lose forever. Sulfonamides, dominant for decades. Combat proven in WW2, stable for 20 years. Then penicillin came along. Patentable, profitable. Sulfa drugs phased out not because they stopped working, but because they worked too long. A drug lasting 2 decades means 1 customer visit. Business model catastrophe. Colloidal silver. Used medically from the 1800s through 1930s. Indefinite shelf life. DIY producible. But you can't patent elemental silver. No patent, no FDA trials. No trials, no approval. The regulatory framework functions to exclude anything that can't generate recurring revenue. Antimicrobial herbs can't be controlled. You grow them without permission. FDA classifies them as food. Knowledge spreads peer-to-peer. This pattern isn't limited to antibiotics. Diabetes management versus metabolic reversal. Cancer treatment focused on recurring chemotherapy. Autoimmune protocols managing symptoms instead of addressing causes. Chronic disease is more profitable than cures. A patient on lifetime medication is worth hundreds of thousands. A patient who walks away is worth nothing. Sulfa drugs available through veterinary suppliers. Colloidal silver kits cost under $50. Herbs grow anywhere. All accessible now. Legally. The system hides them behind silence, not walls. The collapse will be survived by people who built knowledge networks before they needed them. Share this. Teach your neighbor. Build communities that don't depend on pharmaceutical supply chains. Biology doesn't require FDA approval. Bacteria don't check patents before they die.